in clinical research. We are joined by Dr. Desmond Brown, Dr. Rene Cortese, and Dr. Mark Hallett, and they will be speaking today on how to get published, an editorial board's perspective. Our first speaker will be Dr. Brown.
Okay, so Desmond, you may not realize this, but we decided that Katie will just share the slides and everybody can actually request control.
Correct.
Okay. I read the emails earlier, but I'm not really sure how to get control at this point. So perhaps.
Okay, at the very top, it'll say request control.
I see. Gotcha.
And then Katie will give you control. And then in the lower left-hand corner, you can go forward once you get control.
Yes, and you have control. If you see the NIH decal, Dr. Brown, there's a tiny little forward arrow. Yep, right there.
I see. Gotcha. Okay. Well, let's see if it works. There we go. Okay. All right. So again, I'm Desmond. Welcome, everyone. So again, the goal today certainly isn't to try to be exhaustive about the sort of technical aspects of writing or getting published. I think there's not enough time for that in this kind of a setting. And I don't know that this is the goal. I think what I want to share with you are just some more sort of broader thoughts about maybe the rationale for wanting to get published and the way to sort of think about this, and maybe share some of my own experiences with you. I think I have 15 minutes, correct?
Mm-hmm.
Okay, yeah, I'll aim to be timely. All right, so I have no disclosures relative to this talk. The goals here are just to briefly kind of talk about what we mean by clinical research. What are some of the advantages to trying to publish early in your career? Some challenges to that, and just some lessons that I've learned over the years. So broadly, clinical research, this is an NCI definition. I won't read it to you. But in essence, there's more than just clinical trials, right? That come under the umbrella of clinical research. Obviously, clinical trials, and particularly randomized clinical trials, are a very important part of clinical research. But there are other things that are also important. For example, in the field of neurosurgery, where I work, it's really difficult actually to do the gold standard randomized control trial, often because of practical reasons, and other times because of ethical reasons, right? Not many patients with a large glioblastoma are going to sign up for a trial about getting the tumor out or not, right? And neither would many practitioners want to do that. And so then you have to think about, well, how do you actually ask and try to answer questions that might help us evaluate what we do for and to patients, and the efficacy of those interventions. And so everything from retrospective series to large databases that pool patients with rare conditions, et cetera, and all these come under the umbrella of clinical research. So the question is, you're busy enough as a clinician, certainly as a neurosurgeon, you're busy enough. Why try to incorporate publishing? Certainly we've all heard the publish or perish, but there's more. Why is it that this is something that is important to any of us? Why are you here in the first place? And so just some of my own personal musings about trying to think through why an academic career was better suited for me. You can sort of think about, sort of see what are some of my thoughts, but being able to pursue both clinical and scientific interests, and collaborating with people that are much smarter than me, and continue to learn, the ability to travel, some autonomy over my career, all these things are important. But having said that, I think it's important that, certainly for me, and I hope for all the people listening that publications are more than just a means to that end, right? That you can actually, contribute something, and that in itself has intrinsic value, certainly for me. So what are some of the advantages to publishing early in your career? Well, believe it or not, you have more time as a trainee, and certainly in the earlier part of your career before you have so many other obligations. As a trainee, you have many people, including your direct mentors and other ad hoc mentors, that are able to help you, that can help you to gain skills and so on. Your productivity is dependent not just on yourself as it might be when you're independent, but you can use the resources that others around you have. But we talked about expertise, but also funds and so on that you may not need to come up with on your own in order to be productive. So these are all some reasons why publishing early might be helped, but there's some challenges as well, right? So when you're very early, sometimes there's just not enough experience to really know, well, where is the field and what are the unanswered questions and where are the gaps in knowledge? And this is where having good mentors might be helpful. But also from a technical standpoint, how do you design a good research method to ask a particular question? How do you understand where the limitations might be? I mentioned earlier, for example, in neurosurgery, there are many, very sort of specific limitations to the design of neurosurgical clinical questions. And so how do you sort of understand that early? And again, both the blessing and the curse here, your productivity as an early trainee may be dependent on others. And so trying to navigate that early might take some doing. So what are some lessons from my own path? So I'm not going to talk about anything that's basic science here today. I'm going to focus exclusively on sort of clinical questions. And so, I obviously did neurosurgery, so I had a long residency. And so, when I started early, these are two of the first things I did at the Mayo Clinic. One is a paper, just a case report on, a patient who actually caught blastomyces from his dog and had brain lesions, which was kind of interesting. Certainly not something that clinically was an area that I wanted to be published in or necessarily interested in. The other was a very interesting concept where what Mayo Clinic was doing was, they're a very busy clinical center. About 65,000 surgeries are done at the Mayo Clinic in Rochester, Minnesota every year. And so, of course, common things being common, many hip replacements, right? Very busy orthopedic group. And so what they were doing was, for spine surgeries, you always need to have bone that's laid down as a sort of network for new bone to grow over when you're doing fusion surgery. And so what they did was develop a method for taking the cadaveric bones or bones harvested from patients, putting them through rigorous testing, and then having a very inexpensive way of using these bones that were harvested for our patients that needed spine surgery. And so I was asked to sort of write this up. So the first lesson here is just never say no, right? Unless you really have to. Neither of these early papers are things that are of interest to me necessarily, but in doing both of these, they really started me on this this path of being able to ask a question, figure out how to go about answering it. I learned a lot about writing. I started learning about publishing. I got closer with a lot of the mentors in my department, which then allowed me to continue that over the course of training. this is just a a sort of snapshot from my CV, and what you notice is that many of the things I ultimately did were major collaborations. In fact, probably 50% of the papers I've published haven't been necessarily first author or last author papers, but papers in which someone came to me with an idea that you were able to help or guide or so on, or somehow put my skill sets as part of that. And, you can set up this notion that you are productive and scholarly, but certainly by, I've had so much more fun, and I've learned so much more by being willing and able to work with a number of different people on different projects and seeing them through to fruition. So be collaborative is lesson number 2. Then, it's as you develop. So, you've learned some writing, you've learned some of what it takes to actually get published. You've actually, you're growing in your field. Then start asking questions that are of interest to you. So this is one, I've always been interested in sort of global health and sort of the social aspects of health. And so this is one where, I sort of just thought about this one day that, glioblastoma care is really intense, both actually clinically, but also just financially and so on. And so the idea that, you could have different outcomes for patients isn't always necessarily because of some very, very obvious reasons. And so sometimes it's just access, right? And so I wanted to figure out, this is something that was close to me, very interesting to me, how does something like insurance, because the care is so intensive, how does something like insurance affect your access to glioblastoma care and therefore outcome? And so it was kind of just something I mused with a friend of mine sitting in the resident office together, which became actually, interestingly, one of my most cited works from the Journal of Neuro-Oncology. And so just pursue your interests is lesson number 3. You're much more likely to do a good job and to see something through if you're interested in it in the first place. And then, the next lesson is ask important questions, right? So, we would have Friday morning conferences, the tumor conference, and almost every week we'd ask this question about, okay, so someone has a meningioma. It turns out to be a grade 2. They have a gross total resection. And so should they get radiation now, or should the radiation happen later when there's recurrence? And the problem is that meningiomas are one of the most common intracranial tumors, but the grade 2 and 3 meningiomas are very, very rare. And so that's why there's been this sort of paucity of literature on this, because they're so rare. Even a center like Mayo Clinic, where I was, that was so busy, would have only a few cases and therefore couldn't really draw big, do big series. And so how do you address something like that? And this is one of those where we thought of, well, if you can have use data from a national cancer registry to pool those ends together and really try to answer a question like this, that is actually important. And, the outcome from this study was that regardless of the extent of resection, early radiation actually seems to benefit patients in terms of survival and recurrence. And so potentially something that can impact the way that we practice. And so ask those important questions and really think about how you might want to address those. So that's the 4th lesson. And then follow through. So again, this I copied from my CV, right? So these are the things that are kind of in progress. And the point here is keep that section small, right? So whatever you start, follow through. And if you follow through, then, you can move to the next thing. And over time, you'll develop, the level of productivity that you want by just not starting things and then not seeing them through. Set a timeline for deliverables, and that will help you to follow through on the projects that you've started. And then finally, just take pride in what you do. So enjoy it. Make sure that when you put your name on something and it goes out to the world, this will succeed you. This is going to be the way that your field sees you. So do the best job you can at making sure that whatever you put out there is high quality, and then have fun, right? So if you don't enjoy doing it, it's not worth doing. And so I will stop there. Thank you, everybody, for entertaining me.
Thank you, Dr. Brown. And next we'll be hearing from Dr. Cortese.
Let me get there we go.
I requested control, but I'm not sure.
Can you try that one more time? Because it didn't pop up.
So the request control button is gone. Oops, maybe something shifted.
Desmond, did you give up control?
I did.
Okay, good.
So it's fine. I can, if somebody can, oh, okay. Did I do that or did somebody do that? So
I did that. Just say next.
Okay. All right. Hi, everybody. I'm Irene Cortese, and I, like Desmond, I'm a new ACI in NINDS, and my unit is really focused on translational research in progressive multifocal leukoencephalopathy. And prior to being an ACI, I was a staff clinician for about 13 years. I was asked by the group to talk about specifically what it takes to get published. Not really feeling like this is my area of expertise, I decided to approach this by doing an informal, oops, can you do my next slide, please? Taking an informal survey of 10 senior investigators, many of them, I think 50% at NIH, but many at Hopkins and also internationally, basically a convenient sample, not a well-designed study. And what I did was just ask them a very open-ended question. What, in your opinion, does it take to get published? Next button. And these are sort of the results of my survey, very, again, open-ended survey. The categories below are just themes that kept emerging among the various responses. And you can see, obviously, that there wasn't a single thing that everybody said, oh, this is the key point. Instead, the perspective was rather broad with some common themes. And I think the important thing to remember is that these investigators are, of course, engaged in their own research, but they're also reviewers. And so they're also telling us what it is that they look for when a manuscript comes their way for review. So what I've done in the next few slides is presented the 5 most important sort of themes that kept emerging among all the investigators, with some of the actual specific recommendations that they gave. And then we'll look section by section of a manuscript and specific tips. Okay, so we can go to the next slide. So the most important theme that came across in my survey, and certainly that I stand behind as well, is that you need to ask a novel and impactful question. And so in order to do this, the recommendations were, among these investigators, to read lots of papers, really know the literature, attend meetings. And this allows, as Desmond was saying, to really know the gaps in the literature and what you can do and try to answer that will be impactful. So work on a fantastic and important project and make sure that your paper contains new information that is not already available in the existing literature. Next slide. The next theme that kept emerging was the importance of your good and sound data. And the specific recommendations that were given were that you need to take the time to plan your experimental design. So don't rush things. Make sure that you've really thought through the process. Your data should be interesting, rigorous, and timely, which again leads back to a good knowledge of the literature, and that it should be sufficiently complete to tell a story. And one of the points made by one of the people I surveyed was that if your story is incomplete, then the reviewers will ask you to do further experiments to complete the story. And so you may as well think of that in advance. Make sure your data supports your conclusions and obviously use appropriate statistical analysis. Okay, so the next slide. The next theme that came through was that you need to be persistent. Develop thick skin. Rejection is a part of the process. Be willing to shop around. Be willing even to go to a better journal if a lower journal or a less fancy journal rejected you. Always address reviewer comments carefully and respectfully. Revise and resubmit. And also trust that with each revision, your manuscript will get better. Next slide. The other really important theme was about good presentation, and this sort of hooks back also to one of the points that Desmond made. You need to tell a compelling story. That story doesn't need to be the chronological history that you followed in your steps and in your lab notebook. Be very careful about grammar and typographical errors in your actual manuscript. Make sure that you follow clear logic, that your story is clear and easy to read. Avoid long sentences. And also really important in your presentation is make sure you're following the journal's instructions to authors. Always get feedback and help with proofreading, and one of the recommendations that always comes up is if your first language is not English and you're submitting to an English journal, make sure that you have somebody proofread as well if you need that help. Next slide. Another important theme that emerged was, of course, journal choice, and Dr. Hallett's going to be talking a little bit about this, but I just wanted to relay here some of the points that came out of my survey. So the first thing is know the audience that will be interested in your work. Choose the journal to match your paper's content. If you're given that option, suggest reviewers who are representative in the field and that maybe you know to be fair. And for top journals, you may want to consider a pre-submission inquiry. Below this is just an email that I got recently. Once you publish, you get tons of emails requesting, please submit to my journal. And so just beware also of the quality of the journals that you're submitting to. And sometimes that's easy, for example, when they ask me to submit to the Journal of Cardiovascular something or other, but sometimes it can be a little bit less easy to identify a predatory journal. Okay, so next slide. So in the next slides, what I have are some specific tips that are section by section, again, derived from my survey, my own experience, and just generally. So next slide. With regard to your title, what I was reminded of was that you never get a second chance to make a first impression. So try to pick a title that is informative, succinct, and that truly reflects the content of your manuscript. Avoid jargon and abbreviations, and remember that the title that you choose is going to influence the reader's level of interest. So the vast majority of readers are going to spend half a second just glancing through articles to decide whether or not they're going to go on to read the abstract. So make sure that your title is true to the content and that it also is kind of piquing the interest. Next slide. So your abstract, what you're reminded of is that this is really a mini version of your entire paper, and you want to be sure to convey everything that is important in your paper in that abstract, because again, many researchers will only read that abstract. So concisely tell the readers why you did the study and which of your findings were really the most important. And again, you're trying to draw in the reader and get them to read your whole manuscript. Next slide. So the introduction, generally the recommendations are to start with a wide focus to draw all readers in, and then to progressively narrow to provide the rationale behind your own study. Again, avoid using too many acronyms, especially in that introduction, which can be off-putting. Make very clear what your hypothesis is and the objectives that you were pursuing. And the other sort of tip that was given was that this introduction shouldn't be overly long. It's not meant to be a complete and comprehensive review of the literature. And the purpose is really just to orient your reader into what you did and what you think is important. Next slide. In terms of methods, your purpose is really twofold. Number one, to provide the reader with enough information to be able to determine if your results and conclusions are supported by the methods that you used. And number two, to enable people to replicate your study. And one of the common advice that is given is not to over-explain common scientific procedures in your methods section. Next slide. In terms of results and figures, of course, be straightforward, logical presentation. Remember that your results is not where you're really commenting on your data or comparing it to other work. This is really where you're showing your own results. The reader should not have to work to understand your figures, so make sure that your graphs and tables speak for themselves, not overloaded with information, and that labels are really comprehensive so that the reader doesn't have to struggle. Next slide. In terms of the discussion, the recommendations are to sort of go opposite from what you do in your introduction, sort of start narrow from your results and go broad and explain what are the broader implications of your study and your results. Explain what your results mean and don't use this section just to repeat your data that you already presented in the results. Obviously, if multiple explanations are possible for your data, address each of them. Try to explain any discrepancies between your data and those of others. And really importantly, and a common theme that came in the survey was do not overstate the value of your work. And in fact, critique your own work. Identify weaknesses and either try to address them through your experimental design or supplementary experiments, or at least comment on them to the reviewers, because this gives them one less thing that they can critique you about. Suggest future research whenever possible. And the general recommendation was okay to speculate, but don't get carried away. Next slide. In terms of your references, what was really emphasized in the survey and generally is that you need to use current and relevant references. Don't over-reference your own work or that of colleagues. And sort of a reminder that excessive citations don't really show that you're in command of the topic. On the contrary, they probably are showing that you're unable to understand what is important and what is not. And the last recommendation here is never cite a paper that you didn't read. Next slide. So the last sort of piece of advice was over the cover letter. And the recommendation to really take time to write a great but succinct cover letter explaining why the journal should want to publish your paper. And remember that this isn't just to repeat your abstract. Include the editor's name. Again, avoid overstating the value of your work, and make sure that you proofread this letter as well, because it will be your very first introduction of your work. So next and final slide. Just to summarize, I thought these papers were kind of fun and sort of taking everything in the reverse to give our conclusions. The sure way to get your paper rejected are, and probably there are other ways too, but these are on that list. Don't follow the author's instructions. Don't check your manuscript for typographical, spelling, or grammar. Be sloppy. Don't report anything new. Use many abbreviations and obscure terms. Don't mention a hypothesis anywhere in the text and make the reader wonder why you did the study. Plagiarize yourself or others and misquote or omit pertinent references. Ramble, avoid focus, use 20 words when you could use 5, and of course, ask an uninteresting question that does not advance the field. Thank you.
Thank you so
That was
much.
almost like a top 10 David Letterman list. That's
Lots
great.
of lists.
Thank you so much. And now we are joined by Dr. Hallett.
All right. Hello, everybody. To introduce myself briefly, I guess everyone else has done that. I'm the opposite of the other two. I've been at NIH now for 40 years. And I have a lot of experience in writing, reviewing. I've been an associate editor. I've been an editor-in-chief. And I've also been the chair of the publication committee of a number of professional organizations, such as the AAN. So I have a lot of experience in all different aspects of publication. And my topic is to tell you what happens to a manuscript when it is under review. So let's see if I can go forward here. Okay. Whoop, not too far. Okay, so the first is, you've already heard a little bit about this, selecting the right journal. To think about what is the readership of the journal, whether the readers would be interested in the paper or not. And then Irene introduced the notion of the right level of the journal, and that's roughly the impact factor. Everybody agrees that the impact factor is terrible, but still everybody uses it. And it's a quite imperfect measure. It is well known that the sort of general rule is that 80% of the citations of any journal come from 20% of the papers in the journal. So just because it's a high impact journal doesn't mean that all the papers are high impact. And it's not necessarily the best measure, but it is the measure that people use. So you want to choose the appropriate level, but it's not uncommon to shoot a little higher on the first round. Maybe you will be lucky. So that isn't inappropriate, and maybe you'll get some good feedback as well. Even if the paper is rejected in the end, you might get some good information that would be helpful in revision for the next journal. It might be appropriate to write to the editor-in-chief to see if he or she is interested. That is reasonable for some of the top journals. Irene mentioned that earlier, and I think that is a reasonable thing to do. And these days, it's generally okay to submit to a preprint server. So if you have a paper that you really think is important, you want to get the information out, but it may take some months in review, it's okay to put it on a preprint server. The journals do not say that that's pre-publication. It actually is, and I must say I've been somewhat surprised about this, but the preprint servers are in fact okay by almost all journals now. Okay, so what happens when the paper arrives at the journal? There are a number of people that are going to be seeing the paper. The first is generally the managing editor. This is someone who's probably an employee of the publisher, and they want to see that the paper is in good format. It does have to follow the instructions to the author. Irene mentioned that a couple of times. If it doesn't follow the instructions to the author, it may just come right back to you. So that's the managing editor's role, to make sure that the paper is in reasonably good shape. Then it goes to the editor-in-chief, and the editor-in-chief will make a preliminary decision as to whether the paper should be reviewed or not. We'll talk about that a little more in a moment. But it's really the editor-in-chief that decides in the end what goes into the journal. It's the editor-in-chief's journal. He or she is responsible for the journal in all regards. And so the editor-in-chief is responsible for everything that will be accepted in the end. Now, the editor-in-chief can't manage reviews of all the papers him or herself. So in recent years, and that's because of the increasing number of submissions, there's now associate editors. There didn't used to be, but there are now in almost all journals. And the editor-in-chief will either manage a paper him or herself, or give it to one of the associate editors to manage. And the associate editors then are the ones that seek the reviewers or the referees. So it's the reviewers or the referees' job to read the paper. It's the associate editor's job to decide, to make a preliminary decision based on what the reviewers tell them. And it's the editors-in-chief's job to make the final decision based on what the associate editors tell them. So that's the sort of hierarchy of this. Generally, these days, decisions are going faster and faster. You can expect a decision generally within a month, if not 3 weeks. Some journals are still longer than that. But with the electronic publishing these days, things do tend to go faster. I remember when I started as editor-in-chief, everything was still on paper. Things hadn't gotten electronic yet, and it took at least 3 months or so, but everything's faster now. Okay, so the first decision of the editor-in-chief is should the manuscript go into the review process at all? And this is a relatively new step, but one that almost all journals are doing now to save time. There is what's called reviewer burnout. There are too many papers that are being submitted for all the people that can possibly review them at the moment. So most journals now are deciding whether the manuscript should be reviewed at all. And that's the job of the editor-in-chief, often with the help of the associate editors. Some journals will weed out a lot at that step. A journal like Science or the New England Journal will screen out 90 or 95% of the papers at this step. A number of other journals are screening out, say, 50%. Some screen out maybe about 10%. It depends upon how many papers come to the journal and how much they want to actually review them. Manuscript will be tossed out if it's not within scope, or not if the editor-in-chief feels that it won't pass peer review. So if no, it will be rejected without review, and generally that comes back within a week so that you don't waste a lot of time. And if yes, it will go into the regular review process. So generally, if you submit a paper to a good journal and you don't hear within a week, you can breathe a sigh of relief. It's probably gone into the regular review process. Okay, what do the editor or the associate editors do in selecting reviewers? Some journals will ask the authors to provide names of potential reviewers. Most journals may use one or more of them, but may use those names to help them get into the literature to find other people. Authors may indicate reviewers they don't want. Generally, editors follow that as long as there are not too many on the list. I remember once getting a request. I once got someone sent me a list of 15 reviewers that he didn't want. And so I didn't pay any attention to it at all. I said, that isn't anything going to pay any attention to. So what happens, I am sure this is a sham call, but I can't turn it off. Anyhow, authors, okay, so what happens to these suggestions? The editor will look at it and pay more or less attention, as I mentioned. How many reviewers will there be? Some editors go for 2 at the beginning. Now, that seems to be the most common. You do want to have concordance of views, but in case of disagreement, the editor will then need to go for a 3rd. I always went for 3 at the beginning. I always recommend to editors to go for 3. That saves a lot of time. If you have disagreement in 2, you already have the other one cooking. If you have 3 reviews, it's always better than 2 anyway. Some journals practice anonymous reviews, that is to try to make the authors anonymous to the reviewers. It doesn't work very well, but some people try it. As a rule, the identity of the reviewers is not disclosed to the authors, as you know. Right, so the editor's decision, as I said, generally these days it's 4 weeks. Sometimes it can take longer if it's a obscure topic or you can't find reviewers. It's very difficult to find reviewers around Christmas time or sometimes in summer vacation. You can't find anybody in Europe to actually review a paper in August. They're all on vacation. You can see I have a lot of experience trying to find reviewers. Sometimes it takes a long time. So, but if it takes a too long time, you may want to get in touch with the editorial office, find out what's going on. So the editor can decide, accept as it is, extremely uncommon. Revision is the most common if it will be eventually accepted, or it can be rejected. And there could be suggestions as to the indication of a more suitable journal. So rejection, as you already heard, everybody gets in fact rejected. Even Snoopy will get rejected. Snoopy gets rejected all the time, as you probably know. Okay, so don't be sad or angry. It happens to everybody. And at that point, you should consider what to do next. You can drop the idea of publishing the manuscript. You can revise for another journal. You can complain to the editor, but it doesn't work usually. Some of my favorite stories are when I actually complained and it did work. And if you want to know some of those stories, I can tell you about them sometime. They're actually fun, I think, but it doesn't work much at the time. Just in this regard, just yesterday, one of my fellows got a rejection on a revision, and she was very upset. She said, "Well, I answered all the questions. Doesn't that mean that it has to be accepted?" And the answer is no. Just because you revise doesn't mean that it has to be accepted when it goes back a second time. So major revision, you keep calm and you do it. Read the comments carefully. What you think was clearly written might not have been. You need to send a response memo and the new version. The response memo needs to copy the comments to the reviewers, and you want to organize your responses by listing each of the reviewers' comments and addressing each one of those. And if it's accepted, which is what you really want in the end, then you still have to deal with the proof of that. That is very important. Don't forget about dealing with the proof carefully. A lot of errors can creep into the proof when it is typeset. You may have made some yourself, but you really want it to be accurate because this is what's going to be published. So pay a lot of attention to it. A number of people don't do that, and it comes out with, for example, one of the author's names misspelled in the author list. Well, that's pretty embarrassing when that happens. So you do have to deal with that carefully. Generally, you have to decide whether these days to make it open access or not. That is whether it's the reader pay or the author pay. For us at NIH, everything goes into PubMed Central within 1 year, so it becomes open access in 1 year. So generally, I don't pay for the extra year in advance, but sometimes I do if I think the paper is very good. But you have to decide about that. And if it is accepted, start thinking about the next paper. So that's basically what I had to say. There's one point that Irene made, I guess, that I just want to comment on before we get to the questions and answers, and that's about plagiarism. Plagiarism really is an important issue. You don't want to plagiarize other stuff, and you don't even want to plagiarize yourself. Self-plagiarism these days is also considered bad, and journals now have plagiarism software that they can look at. And so some journals will look at every single paper that comes in to check for plagiarism. And that's one of the things that the managing editor may do. And if there's even self-plagiarism, we'll send it back to you. So that is something to be thinking about very carefully. So Katie, I have given you back control, so you can stop sharing, I guess, and we can now answer questions if anybody has them.
Yes, if you just want to go ahead and unmute, you can go ahead or raise your hand and Katie and I could call on you.
I have a question, Dr. Hallett.
Okay. Sure.
So I recently published a paper, and I know that it will eventually end up in PubMed Central. But my understanding after the fact was that the version that was going to be available in PubMed Central was going to be one of the earlier versions and not the final edited version. Can you comment on that a little bit? Because I think that's useful information to know.
Right. Yes. So you are absolutely right in that regard. Actually, I hate PubMed Central. I think it was a mistake to actually do it, but it's there and we have to deal with it. So what it is that PubMed Central gets the last version that was accepted by the journal without the final edits by the publisher and the final considerations of the author. So those things turn out to be different in the end, but it's the journal that owns the copyright of the final product. And so when PubMed Central gets it, they don't get that final copyrighted stuff that the journal has done as well as what the author has done. Now, I think that that's bad to have two different versions out there. And I would think it better for PubMed Central, for that process, to make a deal with the publisher just to have the publisher make it open access, rather than to have two different versions. But that's not what happens. So that, yes, you will wind up with two different things because PubMed Central doesn't have permission to use the publisher's expertise in the final corrections of the manuscript. It can be close. It'll be close, but it won't be exactly the
Hopefully
same.
it's close.
Hopefully it's close. Although, let me just say, even in my own experience, sometimes in the final organization, you'll find that you have perhaps mislabeled a figure or put something out of order by error, or there's something else, and that won't be picked up by PubMed Central. It'll only be picked up by the publisher. So I think the whole business is not good, but it's there and we have to deal with it.
What I found interesting in that process was that some journals will redraw all their figures and remake all the tables so that then the two versions will look quite different, based on your homemade figures and the ones that were, professionally done by the journal. So the look can change quite a bit.
Right, and that's because PubMed Central gets it from the author, and they don't get to benefit from the publisher's work on it. Yeah. Mm-hmm.
Let's see, I see a hand up. If you want to go ahead and just unmute yourself.
Yeah, thank you for all the talk. It was really great. So I have a question. I recently got a rejection, and then they recommended a similar sub-journal. Like this is the same, but they're kind of like their sub-journal. They suggested I could, send them. So I don't know what to think about this. Is it like a positive, negative? How would I pursue on that situation?
Yeah, so I can comment on that. So probably in the last 5 or 6 years, many journals have developed daughter journals or associated journals in which they're willing to, which often have a slightly different flavor certainly less of a reputation, at least in the beginning. And the editors of the daughter journals are cooperative with the editor of the main journal or the primary journal. And generally, if they think that the article might be accepted in the second journal, will actually refer it. That can be good, but in the beginning, when the journals are new, they may not have an impact factor, or they may not even succeed in the long run. So you have to be careful in the beginning of this, but it can be good. So for example, some of them do very well. For example, in the movement disorder field, there's a journal called Movement Disorders. It is really going gangbusters. Its impact factor now is about 9 or 10 or something like that. It's really going very well. About 5 years ago, they spun off a daughter journal called Movement Disorders Clinical Practice. In the beginning, people didn't want to submit to it, but now it is as popular as the main journal. And they're now turning articles away because it's going so well. So you have to look at it carefully. Some of them are very good, but almost all good journals have that these days. And I think one of the reasons is that there's a lot of submissions to these top journals, and they realize that they can't publish them all, but they can service the community with these extra journals. And to some extent, they can also make money with the other journals. So the other thing that is the case for both publishers and professional groups is that they make money on journals. So that if you have a second journal, you have a second source of income for either the publisher or the professional society. So they're spinning off, they're becoming popular. Some of these secondary journals are very good. You just have to look at it carefully and make the decision whether you want to do that or try a different journal.
Thank you.
Do you have any other questions?
I have one.
Okay.
So kind of related, you know, I've thought a lot about sort of paying for the open access versus having readers pay. And it's this notion that maybe not correct, not accurate, but it's almost as though you sort of are paying to play when you do the open access, and whether that's the perception that others might have, or whether it actually impacts the acceptance or not. And so I just wanted to know if Dr. Hallett could comment on that. My other question is, I'm inundated with doing reviews at the moment for several journals. And one of the things I was never at any point trained as a reviewer. And I wondered how, as an editor, you actually go about selecting someone like me to review for your journal. What's that process?
Right. So deal with that question first. As I sort of intimated before, these days there are so many papers being submitted that that we are, as editors, you actually run short of reviewers. You have to do whatever you can do to find a reviewer. And generally, people will search the literature to see if anyone has published in the same field. And if you published in the same field, then you're a prime target for being a reviewer. And if you answer positively the first time, you are in good chance of getting again, because people need people to actually review. And it's very good training, as you intimated, or maybe Irene intimated. It's very good to be a reviewer because you learn a lot from it, but it can take a lot of time. But for people that have been around for a long time, like myself, there is what you call reviewer burnout, I mentioned earlier. I mean, it is impossible. I mean, at this point, honestly, I get about 2 requests every day. I can only do about 1 a week. So almost all the requests I get, I turn down. So if I get a request, someone else has to do it. Maybe it'll come to you in the end. But in any event, there are a lot of papers and there are a lot of reviewers. So I think everybody who is doing well in the field, you will wind up getting a lot of papers to review. Now, in terms of open access, I don't know whether you know the history, but open access began at NIH. It was the idea of the NIH director, who's the fellow who was the head of the Cancer Institute as well. I've forgotten his name at the moment, but it was his idea. He thought that at least NIH work is paid for by the people of the United States because they pay taxes and they get that, so they should be able to read the results without paying for it. And that idea then blossomed. It does make it particularly difficult to publish in open access for people that don't have money, such as people not in academics. It makes it much harder for them. But the open access trend has continued, and more is open access. And that trend is going to continue. It will be eventually, I suppose, within 10 years, everything will be open access. That's just the way that the whole field is moving. So I don't think that will be going backward. Generally, the review process done without consideration of that, so you don't have to worry about whether you're going to pay for it or not as part of the review process. That is not taken into account. That's the issue at the end. But of course, if you submit to a journal that is open access only, you will know that you have to pay if it is accepted in the end. But it is it's a trend that's unstoppable at this point.
Let's see, I have a hand raised from Mark Stacy.
I just want to pile on a little bit to tell you that when you're asked to review, when that review is done, the editors grade that review. And so in almost all journals, there's a little number on a 0 to 4 scale that ranks how well you've done. When I'm selecting reviewers, I look at that number. First, does anybody have one? Because if they don't have one, they've not reviewed for the manuscript. But if you've got below a 3-4 on that scale of 4, you're not likely going to be somebody that we're going to pick unless I'm desperate.
Yeah,
you will get access to their number. I'm curious about what mine is at this point.
So I don't have access to my number in the journals that I'm an editor for. So they keep that very quiet, and probably because mine's so bad, I don't know.
All journals don't have that, but you know, some do, and that is helpful for the editors, the associate editors, for sure. Yeah. Yeah, but Desmond, you must have been doing pretty well.
All right, well, we have now gotten past the hour. If there are any additional questions, please feel free to email Katie or me, or I'm sure the good doctors here will field additional questions as they come up. The session has been recorded, so I will attempt to publish it to our website at some point later this week. And yes, thanks for joining us. Thanks for presenting. Thank you.
Yes, very informative session. Thank you so much, everyone.
Thanks for the invite. This was fun.
Bye-bye.
Yeah.
Take
Have
care.
a good day.
Thanks.
Bye.